My name is Rachel Gold. I'm a health services researcher with a joint appointment at the Kaiser Permanente Northwest Center for Health Research and as the lead research scientist at OCHIN Incorporated. The article on which I'm the lead author that's appearing in Mayo Clinic Proceedings is titled Reporting on the Strategies Needed to Implement Proven Interventions, an example from a real-world cross-setting implementation study. Well, many healthcare interventions are proven effective in a given setting, but only very slowly and sometimes never are they spread beyond the setting where they were developed. Implementation science is trying to improve this, but scientific papers from the field usually focus only on how precisely a given intervention was replicated in a new setting. They often leave out an important point, which is what were the implementation strategies that were used to help implement the intervention in the new setting? How much did these strategies differ from those used in the original setting? And implementation strategies are the specific approaches, methods, structures, and resources involved with introducing an intervention in a given setting. It's essential to consider implementation strategies and which strategies were used when evaluating how well an intervention does in a new setting, because the intervention's success might be very much impacted by how it was implemented, the strategies used to implement it. But until recently, there's not been a clear way to report on these strategies, and so they've gone very much underreported in the implementation science literature. Anola Proctor, one of our paper's co-authors, and her team recently developed a framework for reporting on implementation strategies. The framework is the first to explicitly describe implementation strategies as a distinct group of factors to be recognized and reported in this field. Our Mayo Clinic Proceedings paper demonstrates how to use that framework and provides an example that others may follow. We use Proctor's framework to describe the strategies our team used to implement a quality improvement intervention that was first developed and tested in a large integrated care setting and then translated for implementation in 11 community health centers. Overall, the large setting that developed the intervention described here used a top-down implementation strategy. But when the intervention was implemented in community health centers, we used a practice facilitation implementation strategy. So using the terms of Proctor's reporting framework, the affected target of the intervention, the clinic staff, and the outcome, which was prescribing rates for patients with diabetes, were the same in both settings. But the differences in resources and organizational structure between the settings made it necessary to adapt the implementation strategies actor, action, temporality, and dose. This article is thus one of the first to demonstrate using Proctor's framework to describe the strategies used to implement a single intervention across care settings. In this paper, we show the value of this framework in reporting on context-specific adaptations made to implementation strategies. The takeaway message from this article is that it is feasible and important to report on how interventions are implemented. The Proctor framework should be used to guide that kind of reporting. The framework helped us describe how implementation strategy elements were adapted across settings, which really helped us understand their effects on how well the intervention itself did. When reporting on these strategies, researchers should consider a number of points. First, can you use a standardized reporting approach to describe your implementation strategies? Did you clearly name the discrete or component implementation strategies that were used? What level of granularity are you reporting on? What is missing? Are there multiple components within an overarching strategy, and did you describe them well enough that they can be replicated? We hope that this paper encourages researchers to consistently report on implementation strategies and ideally use the Proctor framework to support that reporting. Real-world clinicians hoping to replicate effective interventions need to know both which intervention components are critical and which implementation strategies may best support effective implementation of that intervention in new settings. If specific strategies are essential to that implementation, failure to report on them means they may not be applied in future work, so an intervention may not work in a new setting because inappropriate implementation strategies were used. Clear and standardized reporting on the strategies used to implement effective interventions could address barriers to disseminating such interventions, which could in turn help facilitate real-world practices implementing effective interventions more efficiently than is currently possible. We need much more research on which implementation strategies work best in which care settings, and how much you can adapt these strategies that are used to implement a given intervention in a new setting before that adaptation actually affects adoption of the intervention and thus its impact. We'll only get this knowledge if researchers consistently report on implementation strategies that they use in diverse care settings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.